Okay, good morning, Mrs. Ears. We are together just to share with some people about how your positive changes, positive symptom changes, I should say, relief of symptoms from your what you thought was interstitial cystitis condition, right?
Correct.
And what did a doctor ever diagnose it as IC or interstitial cystitis, or was that is that what you suspected it was?
Basically, when I went in for UTI, they told me there was no infection, and then they gave me this pamphlet on IC and told me to go home and follow the diet and follow the routine for that. They suspected it was that, but I was never officially tested for it.
Okay, so with the UTI that you thought it was, and the reason why you went to the doctor to get that urine test done was because you were having pain, it was because of pain, correct?
Correct.
And was it only a pain during urination, or was it pain at other times of the day and night?
It was pain all times of the day and night.
Okay, was the
It
pain?
was constant.
It was constant. It never let up at all. There was zero relief. And was that pain on a scale of 0 to 10, if you can remember now, because what we're reporting is that you don't have that pain anymore, right?
No pain.
That's where we're going. So your pain, if you can recall what it was like a year ago, was 0 to 10. If 10 is the worst pain that you could experience and 0 means no pain, how intense was the pain that you experienced throughout that 24-hour period of time, which was going on for months?
I would say it was about 9.
About a 9. Was there anything that you did that helped alleviate the pain at all? Were there any supplements that worked? Were there any therapies that worked? Were there any meditations that worked or dietary changes that worked that helped you get any relief at all?
Yeah, the dietary changes helped a lot. If I ate a very bland diet, it seemed to subside a little bit. But anytime I tried to eat very much, then it came back again.
It came back again. So with the bland diet, how much reduction in pain do you remember? Was it like a 10% or 20 or 50%?
Maybe about a 30 or 40%.
30, 40. So it was still pretty intense. It wasn't good
Yeah,
enough.
so
Okay, and with what the doctor did was run just a urinary tract infection test and said there was nothing. I'm just repeating. I'm sorry what you said before. There was nothing wrong. There was no infection there that they could find in the urine, and so the interstitial cystitis was a possible next thought or next possible the reality of what you were dealing with. You had tried various supplements. I think one of them you called was a bladder ease, it was called, and you took some cranberry and so
right.
on. Did those provide you any relief from the symptoms at all?
The bladder ease helped after about a week or so. That did make it bearable, but it just kept coming back all the time when the pill would wear off. So I was constantly taking the bladder ease pills, but that was the supplement that helped the best.
Okay. But again, it helped the best for the short period of time. So you were looking for complete relief. You wanted to resolve this problem.
Right.
One other symptom that you had was a periodic, let's say, incontinence or leakiness you had. You had an
Yes.
overreactive bladder. Sometimes it would just come out, right?
Right.
Okay, so now your visit with me was in July of 2017. You came to my clinic, which I'm here in Florida, and you came from out of state, and you followed a protocol, which was, I believe, approximately a 2-month protocol. Uh, First of all, was that protocol pretty simple to follow?
Yes, it was very simple
Okay.
to follow. The instructions were very accurate for me. Yeah.
Okay, good. And your relief, which you did report to me in an email, was that you were surprised that the burning had decreased greatly, that the pain had decreased greatly, and that the leaking, you were able to control your bladder. There was no leakage,
Correct.
right? And so now we are a year, let's just say, since you completed, give or take, a couple of weeks since you completed that protocol. We're about 11, 12 or so months into the future from when you came to me and took that protocol. Have you had any interstitial pain, that kind of bladder, constant, intense, severe pain, that 24-hour kind of pain? Are you experiencing that still?
No, I'm not experiencing any pain at all, and I can pretty much eat anything again and drink anything, and um, it's 100% better.
Awesome. And has there been any other kind of therapy? Has there been any other kind of need of any other kind of supplement or anything else that you've had to do in the past 12 months besides what you did for me?
Absolutely nothing.
Okay. Is there any leaking at all now? Is there any loss of bladder control at all?
No.
Okay, excellent. So I really, and one of the other symptoms was there was some fatigue that was going on. with you before you came to me,
Yes.
right? And that was one of the other symptoms that we had to work on. Was that fatigue only because you were staying up at night because the pain? Well, I'm letting people know that already without asking you and you telling anybody. But did this bladder pain back then wake you up at night?
Yes, it did. It kept me awake most of the night.
And with that now relief of the bladder pain and you're able to sleep at night now because there's no pain?
I'm able to sleep through the night, yes.
Excellent. And so is the fatigue the same now? Is the energy level, I should say, the same now as it was back then, or has there been an improvement in the energy level?
Oh, a great improvement. I'm not fatigued at all anymore, other than if I'm just tired because I'm tired, but not because of this situation.